My name is Eva Orén, and I'm the director of the Medical History and Heritage at Karolinska Institutet. And I wish you all a warm welcome to the 2024 Hagströmer Lecture, which is a collaboration between Karolinska Institutet and the Friends of the Hagströmer Library. And our distinguished speaker today is Anita Guerrini. She is Horning Professor of the Humanities Emerita at Oregon State University in the United States, as well as Research Professor at the University of California, Santa Barbara. And her research encompasses the history of the life sciences, medicine, and the environment since 1500 up until today, almost. Her work is well known to anyone interested in the field of human-animal studies, but also in the history of anatomy and physiology. Among her publications, many publications, I'd like to mention the two books, The Courtier's Anatomists, Animals, Humans, and in Louis XIV's Paris, which came out in 2015. And also this book that I have here, which maybe I should pass around so that you can take a look at it. You can pass it on, which is called Experimenting with Humans and Animals, From Aristotle to CRISPR, which came out in a second revised and updated edition in 2022. And I should say to you all that the lecture and the question and answer session are going to be video recorded, just so you know. And the video will also be published on our website a couple of weeks from now, so you will be able to see it and also recommend it to friends if you want to. And there will be a reception after the talk, which will be out here in the hall outside. And yes, now Anita's lecture today is, let's move to the next one. Yes, it's titled Foreign Bodies, Humans, Animals, and Vaccine Development. And so, please join me in welcoming Anita Guerrini.
This on? Okay. Thank you for coming, and thank you, Eva, for your introduction, and thank you for inviting me. I'm very happy to be here, and I'm sure we'd all rather be outside. It's such a beautiful day. So today I'm going to talk about three interrelated schools of thought that are not always considered to be connected, which is anti-vivisection, anti-vaccination, and anti-immigration, so three antis. I'll look at these in three different time periods: the period from the introduction of the smallpox vaccine in the 1790s to the first laws making vaccination mandatory in the 1850s. Secondly, the period of the introduction of the germ theory of disease and the first vaccines for diseases other than smallpox from about 1880 until 1920. And finally, the period from the polio vaccine in the 1950s to the present. I will focus mainly on the Anglo-American world, and my theme encompasses the intimate relationship between human and animal diseases and the role of animals in the development of vaccines, as well as the contrasting discourses of purity and impurity, of beastly and human, of foreign and native, that pervade discussions of vaccines dating back well over 2 centuries. These dichotomies, once believed to have been largely overtaken by scientific successes in eradicating diseases, have returned in force in the last several decades. This is particularly so in the American context, but it's evident throughout the Western world. The COVID pandemic has both reinforced this rhetoric and in some ways has upended it. So my story begins with this 1802 caricature by the illustrator James Gilray. In The Cowpox, or the Wonderful Effects of the New Inoculation, Gilray depicts Edward Jenner, who announced his vaccine for smallpox in 1798, in the midst of administering it to an anxious and credulous crowd. An assistant administers an opening mixture you can see in the sort of pot up there on that far right. with a clyster nearby should the mixture not have the required effect. Physicians commonly employed purging to prepare the body to receive medications or other therapies, providing a blank slate, as it were. Jenner himself, soberly dressed, opens a vein in the arm of a suspicious woman. Another assistant, who may represent James Phipps, a child who was the first human recipient of the vaccine, holds up a crock, and this is the boy in the blue jacket there, that says vaccine pox straight from the cow. In his back pocket, he has a pamphlet titled Benefits of the Vaccine Research. The next step will be for a bit of the vaccine pock, which looks suspiciously like pus, to be inserted in the woman's arm. Meanwhile, all around, chaos reigns as the vaccinated begin to spout miniature bovines from every part of their bodies. As we all know, the World Health Organization declared smallpox to be officially eradicated from the earth in 1980. It is still the only disease to be so designated. In its virulence and lethality, as well as its endemicity, smallpox was the most feared and loathed disease in the 18th century. Smallpox was an ancient disease, but it seemed to emerge fully in Europe only in the 16th century. It was particularly lethal in childhood. And this is a WHO poster from the 1960s when smallpox was still around, particularly in the Third World. In an average year, about 20% of all those infected died. In years of epidemic, which were many, that figure rose to 40% or more, which is a very high death rate. Those who survived endured disfigurement or even blindness. It was widespread, and it was quite contagious. Inoculation, the deliberate inducement of a mild or hopefully mild variety of a disease in order to confer immunity, entered Europe in the early 18th century. Parents before this time had been known to buy the pox from someone infected or allow their children to be near relatives and friends who were ill because they believed that you could only catch smallpox once. This was not entirely true. Smallpox immunity from vaccination or disease lasts around 20 years, so people my age who got vaccinated when they were children were no longer immune from smallpox, but hopefully it doesn't come back. But it was true enough. Reports from China, the Middle East, and Africa seem to confirm the practice of inoculation. To us, it seems incredibly risky. Those who were inoculated could and did pass the disease on to others. And there was no guarantee that the virus would not mutate and cause a more severe case. But fear of the disease meant that inoculation became widely practiced during the 18th century in Europe. Those who opposed inoculation generally argued from two perspectives. One was religious. If God wanted to give us smallpox to punish us for our sins, we should not interfere. And this argument was particularly popular in Puritan New England and in Catholic France. But the other argument was that for medical practitioners to deliberately induce a disease was immoral, unethical, and risky. Edward Jenner, who was a country practitioner who had trained in London, began to investigate smallpox in the 1780s. As an experienced inoculator, he became interested in a disease called cowpox that affected both cows and the humans who worked with them. And more broadly, he became interested in the interrelations between human and animal diseases. Jenner believed that cowpox and the horse disease known as the grease were one and the same, and that these in turn could confer immunity to smallpox in humans. Cowpox in humans was much milder than smallpox, with few lesions and much less severe illness. During the 1780s and 90s, Jenner collected case histories of patients who had contracted cowpox and were then found to be resistant to either natural or inoculated smallpox. And he documented 23 cases in this book, an inquiry into the causes and effects of the variolae vaccinii from 1798. The boy, James Phipps, was number 17 of these cases. These case studies convinced Jenner that vaccination was an effective and safe alternative to inoculation with smallpox itself. This sort of inoculation was also known as variolation. By referring to cowpox, or vaccinia, as variolae vaccinii, that is, cow smallpox, sorry, flip it over here. Jenner asserted a necessary relationship between the two diseases. He was essentially correct, although neither he nor his contemporaries understood why. Vaccination largely replaced variolation, but not everyone took advantage of it. The concerns about effectiveness that later emerged, when it turned out that vaccination did not incur lifelong immunity, were initially allayed by the example of the boy James Phipps, whom Jenner publicly injected with smallpox many times, and he never got sick. But of course, these injections probably boosted his immunity as well. Opposition to vaccination followed along the lines of the earlier opposition to variolation. The influential Austrian hydrotherapist and naturopath Vincent Priesnitz echoed religious arguments against variolation, but gave his own twist when he claimed that smallpox, quote, relieves the system of humors that ought to be carried out of it and is a healthy process, end quote. However, the addition of animals added another layer of concern. Gilroy satirized public fears of contamination caused by mingling human and animal body fluids and of violations of bodily integrity. In the 1820s, a popular British writer objected to vaccination merely on the score of its beastliness, and a later anti-vaccination treatise referred to the profanation of humanity by injection with bovine disease. As governments moved to make vaccination mandatory, additional objections emerged to government overreach. A good example of opposition to vaccination in the era just prior to the introduction of the germ theory of disease is provided by the last smallpox epidemic in Sweden, which is here in Stockholm in 1873 and 1874. Inoculation had been practiced in Sweden in the 18th century, and vaccination was introduced in 1801, so very soon after the publication of Jenner's work. The first measures making vaccines compulsory were introduced in 1816, which is, I think, the first in all of Europe. And by 1853, vaccination was required of all children by the time they reached the age of 2. As happened elsewhere, Swedish officials realized by 1853 that vaccination did not confer lifelong immunity, and revaccination was added to the new law. However, the outbreak of smallpox at the end of 1873 revealed large numbers of unvaccinated children. Causes of resistance to vaccination included religious Protestants who echoed the Puritan rhetoric of disrupting God's plan for humanity, the need for revaccination, which a lot of people resisted, and rumors circulating about side effects, including the introduction of other diseases such as syphilis via vaccination. And this latter point was actually quite plausible because the method of vaccination was known as arm-to-arm. In other words, someone got vaccinated and you took then the blood from that person and gave it to another person. So the idea was if that person had another disease, you would get that disease too, which sometimes happened. Moreover, confusion over disease causation in this era before the germ theory led to greater emphasis on cleaning the internal and external environments, which, going back to hydrotherapy, which fit well both with public health advocacy that emphasized cleaning up poor neighborhoods and with naturopaths who, following Priesnitz, thought of disease as part of the body's self-cleansing process to be helped along by water baths and clean food. These advocates argued that the drop in the number of deaths that seemed to follow vaccination, excuse me a minute. The drop in the number of deaths that seemed to follow vaccination was actually a result of greater overall health from these kinds of regimens. The vaccination had nothing to do with it. The emphasis on cleanliness and purity targeted the lower classes who were already suspicious of government measures and who resisted compulsory vaccination as undue coercion. Although there was, to my knowledge, no organized anti-vaccination activity in Stockholm, these factors depressed the numbers of the vaccinated enough to allow an epidemic to occur. The shock of this epidemic on Swedish society led to much more rigorous enforcement of compulsory vaccination. Now, concern for animals does not seem to have been a factor in this opposition to smallpox vaccination. An anti-vivisection movement first began to emerge in England in the 1820s triggered not by vaccine research, because there wasn't really any vaccine research, but by new advances in physiology, which were mainly achieved by animal research, and by pretty violent animal research. In this age before anesthesia, these experiments were often extremely painful to the animal. A visit to London of the influential French physiologist François Magendie in 1824 triggered this movement. And here is a testimony in Parliament in 1825 about Magendie's visit. There was a Frenchman by the name of Magendie, a disgrace to society. In the course of last year, this man at one of the anatomical theaters exhibited a series of experiments so atrocious as almost to shock belief, and this was a demonstration of nervous system on a dog. This visit became a kind of 19th century meme, lining up pro and anti-vivisectionists on either side, and it persisted even after Magendie's death 30 years later. The anti-vaccination movement came to a head in Britain in the 1850s and 60s in the wake of two acts that made vaccination compulsory. The first in 1853 for infants, and the second in 1867 for all children under the age of 14. A corresponding bureaucracy was set up to administer these laws, and this was certainly one focus for opposition, as it was in Sweden. However, there were also strong ideological arguments that found increasing overlap with arguments against vivisection, particularly as a robust germ theory emerged in the 1870s and new vaccines began to be developed. In the United States, Henry Berg, a founder of the anti-vivisection movement there, also opposed vaccination. In addition, he criticized a new wave of immigrants who practiced barbarous animal sports such as cockfighting. So let me now turn briefly to the shift in the focus of biological research from physiology to bacteriology. In 1878, a Frenchman coined the word microbe to denote a microscopic infectious agent. Microbe soon encompassed a great variety of organisms, including bacteria, protozoa, and fungi, each of which caused infection in different ways. Other infectious agents for diseases such as smallpox and rabies could not be found and were presumed to be too small to be viewed under conventional optical microscopes. And these agents are, of course, viruses. The adoption by scientists and physicians of the germ theory of disease, which stated that contagious diseases were caused by the action of microbes, opened new arenas for research that promised immediate human benefit. Although physiologists promised that their research on animals would lead to the improvement of human health, they generally placed these goals far in the future. While physiology and microbiology differed, each discipline depended especially on animal bodies for experimental proof. Over the next 20 years, that is, from about 1880, the promise of science to improve human health became a reality. By the 1890s, new microbes were seemingly discovered daily, and a new vocabulary of vaccines, immunizations, and antitoxins entered everyday life. Two men were largely responsible for the development of the germ theory of disease in the late 1870s, although there are many other people working on this, and its subsequent public acceptance, the French chemist Louis Pasteur and the German physician Robert Koch. Employing many animals and a few human subjects, they developed the theories and techniques that received their fullest expression in the years before World War I in the Frankfurt laboratory of Paul Ehrlich. With Ehrlich's work on syphilis, the laboratory decisively joined the clinic in the task of preventing and treating disease, and scientific medicine became a reality. The anti-vivisection movement that spread across Europe by the 1870s focused on physiology, not on the germ theory. It reached a peak with the passage of the British Cruelty to Animals Act in 1876, which regulated animal experiments in Britain. This was the first law to regulate animal experiments, and for a long time it was the only law to regulate animal experiments. The focus on physiological research and pain, however, began to be overtaken by events. Anesthesia, introduced in the 1850s, mitigated the pain issue, although it was very unevenly applied, even to humans. Experimenters argued that animals did not feel pain as acutely as humans, In England, the Darwinist and science promoter Thomas Henry Huxley agreed with Descartes that animals felt pain emotionally but not intellectually. And he said some experiments simply required pain to be successful. Moreover, it was believed by many that humans also felt pain along a scale. And generally speaking, women, lower classes, and people of color were deemed to feel pain less acutely than kind of upper-class white men, and therefore required less anesthesia or even none at all. There was a lot of controversy about using anesthesia in childbirth, and Queen Victoria used anesthesia for the birth of her youngest child in 1857, which somewhat smoothed out that criticism, but not entirely. Anti-vivisectionists contended that a century of physiological research had yielded no new cures for diseases, despite decades of animal suffering. The diseases of the 19th century, such as cholera, typhoid, and tuberculosis, were diseases of filth and poverty. The miasm theory of disease pointed to bad smells, dirt, overcrowding, and unclean water as sources of disease. Of course, they weren't wrong. Public health advocates noted that improved sanitation greatly reduced the incidence of diseases such as cholera. As we saw in Sweden, these measures overlapped with naturopathic recommendations in the 1870s. A language of purity tinged with paternalism contended that the poor simply had to be taught how to live properly. The introduction of the germ theory of disease threatened to upend this apparatus of public health and sanitation and introduce a new and unknown quantity. In 1877, Pasteur and Koch each published on the etiology of anthrax, describing its life cycle, how it got into the blood, and how it caused disease. And this was the first widely accepted demonstration of a bacterial cause of disease. Now, anthrax was primarily an animal disease that sometimes attacked humans. It was also a comparatively large bacteria that was easily distinguished under a microscope. In a paper on wound infections published in the next year, Koch discussed his procedures, which came to be known as Koch's postulates. And these are just how you proceed in isolating a microbe and showing that it causes a disease. So, and I'll let you read these. I won't read them out loud. These postulates emphasize the cultivation of the suspected microbe outside the human or animal body in the controlled environment of a sterile artificial medium. Koch himself used a variety of gelatin. Nonetheless, he also used animals to retrieve and to test for the specificity of microorganisms, because in order to show that the organism caused the disease, you had to make a well animal sick. So, and he reasoned that animals were receptacles for the microorganism, just as the dishes of gelatin were. In developing vaccines for anthrax, chicken cholera, and swine fever between 1878 and 1883, Pasteur followed Koch's techniques with great success. In each of these cases, Pasteur developed a vaccine by weakening the virulence of the microbe, whether by heat, by chemicals, or by prolonged exposure to the air, and then tested their effectiveness on animals along the way, sometimes many, many animals. In these studies, Pasteur discovered that the virulence of a microbe could also be altered, either increased or decreased, by passing it through living animal bodies. For example, Pasteur passed attenuated cultures of chicken cholera through a series of chickens to increase its virulence. Koch had also noticed this phenomenon and thought that the repeated passages served to purify the microbe. Pasteur gradually came to realize that the microbe itself changed, it mutated. He employed this technique with rabbits, dogs, and monkeys to develop his vaccine for rabies, which was first used in 1885, and which is what made him really famous. Between 1880 and 1900, the microbial causes of several diseases were isolated. Yet scientists disagreed about many issues, including how infection worked, how the body resisted infection, what immunity was, which was something that took a long time to be understood, and how vaccines worked. Pasteur's rabies vaccine gained much public attention, but so too did Koch's failure to develop a tuberculosis vaccine. The discovery of the malaria parasite in 1880 enabled physicians to use the centuries-old medication of quinine only for malaria and not in other fevers. And tests to detect the presence of other disease-causing microbes made diagnosis more accurate. Nonetheless, diseases seemed ever more variable. One thing was certain: the new techniques of microbiology and bacteriology required the use of many animals. Physiological experiments used basically one animal at a time. Pasteur required dozens and then hundreds. Ehrlich employed thousands to develop his cure for syphilis, known as salvarsan, which was introduced in 1909. And in these kinds of experiments, anesthesia was really irrelevant. Many lay people and many physicians remained unconvinced of the value of the germ theory. The miasm theory of disease, which pointed to dirt, overcrowding, bad air, and unclean water as sources of disease, seemed far more rational and produced positive results. The inconsistent behavior of microbes and the failure to isolate microbial causes for all diseases discredited the germ theory. Viruses continued to be poorly understood. They were basically thought to be especially tiny bacteria. And researchers failed to find microbial causes for deficiency diseases such as pellagra and beriberi and scurvy. The language of purity and impurity in the public health movement also condemned the introduction of foreign substances such as vaccines into the body. How could injecting diseased tissue, particularly diseased animal tissue, make you well? Anti-vivisection and anti-vaccination advocates therefore found much in common and much to criticize in the new bacteriology. The Irish playwright George Bernard Shaw offered a witty but scathing attack on the germ theory, vaccines, vivisection, and the medical profession in his 1906 play, The Doctor's Dilemma. In his preface to the play published in 1909, Shaw, who was a prominent socialist and a very popular public figure, expressed widely shared doubts and confusion about the new scientific medicine. The poor and ill, he said, needed better food and housing more than they needed medicine. And scientific medicine did not keep people healthy, but attempted to cure them after they got sick. Shaw was skeptical about the new theories. He said, "I have heard doctors affirm and deny almost every possible proposition as to disease and treatment." He wasn't wrong about that. He pointed out that many germs had not been seen, such as those of smallpox and rabies. Was not bacteriology, therefore, mere superstition? Common sense and cleanliness should win the day. Continuing this theme, Shaw believed that immunizations were, quote, dirty, dangerous, and unscientific. They were no better than injecting dirt. Koch's failure to develop a tuberculosis vaccine showed that doctors, in fact, had little knowledge of the causes of disease. He characterized immunizations as a plot to make money for physicians, and vivisection was simply another fashion that physicians slavishly followed. The right to knowledge, he argued, does not include the right to cause pain, and indeed doctors, above all, should not cause pain. Shaw therefore exposed and reinforced the close connections between anti-vivisectionists and anti-vaccinators. Perhaps inadvertently, he also exposed the connections between them and emerging rhetoric on immigration, particularly in the United States. Vaccines, said Shaw, put mysterious, dirty, foreign, and often animal substances into our bodies, often with unpredictable results. The hordes of non-Anglo immigrants to the United States began with the Irish in the 1840s and continued with Chinese and other Asians in the 1860s. After 1880, it reached a peak of Southern and Eastern Europeans who were moreover mostly Catholics or Jews. And this mass migration evoked language of invasion and contamination of the so-called native white Protestant body. This is no coincidence. Shaw often spoke of Jews as poisoning the body politic. And as we see from this quote, he was a well-known supporter of the program of selective breeding known as eugenics, as were many socialists of his day and of his generation. As we've seen, the poor in the 19th century were often considered to be slightly less than human by the governing classes. And this characterization was doubly so for immigrants who were not considered to be white and clean in the same way as Northern Europeans. In the United States, the Chinese Exclusion Act of 1882 had already limited Asian immigration. In 1924, a eugenics-inspired immigration act in the United States acted on this rhetoric and severely restricted immigration from less favored countries in Southern and Eastern Europe, and almost entirely banned immigration from Asia. This law was only overturned in 1965. And a new influx of immigration would lead to the return of the rhetoric of invasion and contamination. So on to part 3. And just to note, in this picture you can see Robert Kennedy and his brother Teddy next to him on the far left, because another Robert Kennedy will come into the story in a few minutes. When I was a child in the late 50s and early 60s, Jonas Salk was venerated as a hero. And here he is. Everyone knew someone who was living with polio. And the arrival of Salk's vaccine in 1955 seemed like a miracle to anxious American parents who had witnessed the polio epidemic of 1952. Following the continued successes of bacteriology, which included during World War II the introduction of penicillin and later other antibiotics and the influenza vaccine, the anti-vivisection movement was at a low ebb, despite the large number of animals used in the discovery and manufacture of new vaccines and antibiotics. Although anti-vaccination protests had emerged periodically earlier in the 20th century, mainly in opposition to government coercion, I've found no evidence of protests against the polio vaccine. If you know of any, please let me know. Honestly, I haven't found any. Parents, including mine, eagerly lined up their children for the polio vaccine, first the Salk vaccine in the 50s, and then in the early 60s, the Sabin oral vaccine. Its safety and efficacy had been proven many times over, as confirmed by its approval by the US Food and Drug Administration and by over 1 million children enrolled in a very large clinical trial as polio pioneers in 1954, before it was approved. New polio cases in the United States dropped from 58,000 in 1952 to 5,000 in 1960 to near zero in 1970. It was very dramatic. Salk had used at least 1 million monkeys to develop the polio vaccine, and its manufacture required many millions more. In 1955, nobody seemed to care about that, or the fact that the vaccine essentially injected monkey tissue into the human body. From the 1930s into the 1990s, a long line of vaccines came into use in the United States, mostly against childhood diseases. These are just a few. These included vaccines against pertussis, also known as whooping cough, against measles, mumps, chickenpox, as well as the first influenza vaccine in 1945. By the 1970s, 2 sets of trivalent vaccines, known as MMR in the United States for measles, mumps, and rubella, and DPT, or sometimes DTP, for diphtheria, pertussis, and tetanus, became routine parts of infant immunization in the United States, along with the polio vaccine. In 1974, the World Health Organization announced an expanded program of childhood immunizations for developing nations that would include diphtheria, polio, tuberculosis, pertussis, measles, and tetanus. To many epidemiologists in the 1960s and 70s, the world was entering a period of health transition, characterized by a shift from infectious diseases to chronic diseases, such as hypertension and heart disease. This optimism did not last long, for 2 reasons. The uptake of vaccines for measles and mumps, for example, in the US was nowhere near the levels of the polio vaccine, and nowhere near the levels needed to prevent outbreaks. In this way, polio may have been an outlier. Measles and mumps were viewed as everyday childhood diseases and didn't inspire the same fear as polio. Even after many states in the 1970s made the 2 trivalent vaccines mandatory for attendance at public schools, compliance has always been problematic and varies a lot from state to state. The second blow to the optimism of a health transition was the emergence of so-called novel viruses and emerging diseases, as well as resistant strains of older diseases such as tuberculosis and cholera. The first outbreak of Ebola in West Africa in 1976 was followed in the early 1980s by the emergence of HIV/AIDS. In her best-selling book, The Coming Plague, published in 1994, a book I have used for courses for about 10 years, science journalist Laurie Garrett described emerging diseases as the top problem of the 21st century, triggered by environmental degradation, climate change, and failure by Western governments to see public health as a global problem and not just a local problem. The anti-vivisection movement also revived in the mid-1970s with the publication of Australian philosopher Peter Singer's Animal Liberation. Singer presented out animal liberation as the obvious next step to the movements of the 1960s for racial and female equality. Drawing on the utilitarianism of 18th century British philosopher Jeremy Bentham, Singer argued that the true measure of moral principle is the ability to experience pain or pleasure. So it comes back to pain again, not an abstract notion of rights. Governments and individuals should aim to maximize the happiness of the greatest numbers, and these numbers should include animals. Animal research was only one of Singer's concerns, and actually it was not his central concern. His central concern was farm animals. And his position, as expressed in the 1990 edition of Animal Liberation, has mainly to do with invasive animal testing and experimenting, rather than vaccine development. He even wrote, and here's a kind of long quote, "No doubt there are some fields of scientific research that will be hampered by any genuine consideration of the interests of animals used in experimentation. No doubt there have been some advances in knowledge which would not have been attained as easily without using animals. They include the recognition of poliomyelitis as a virus and the development of a vaccine for it." So he's admitting that the polio vaccine was actually kind of worth it. Nonetheless, he added, any knowledge gained from animal experimentation has made, and this is a really long quote, which I'm not going to totally read, has made at best a very small contribution to our increased lifespan. Its contribution to improving the quality of life is more difficult to estimate. Okay. Even if valuable discoveries were made using animals, we can't say how successful medical research would have been if it had been compelled from the outset to develop alternative methods. And he's saying, well, some discoveries might have been made, some of them might not have been made, but it's possible, he says, that medicine would have developed in a very different and more efficacious direction, emphasizing healthy living rather than cure. So we get right back to the 19th century. If we emphasize healthy living, we don't need animals. But vaccines may be the exception to that. And as we'll see, the outbreak of COVID led to some unexpected shifts of opinions. Now, an organized movement against childhood vaccination, I'm going to get rid of this quote, began to take shape in the US in the early 1980s when a mother named Barbara Lowy Fisher claimed that the pertussis vaccine, the P in DPT, caused her child's autism. Others with similar claims joined her in a group originally called Dissatisfied Parents Together, or DPT, and later changed to the more official sounding National Vaccine Information Center. I won't get into the claims that Fisher made, only to note that the pertussis vaccine as originally formulated did have side effects in certain individuals, but autism was not one of them. The infamous 1998 article by British physician Andrew Wakefield, that I'm sure we're all familiar with, that claimed a connection between the MMR vaccine and childhood autism only added fuel to an already brisk fire. The language employed by this new generation of anti-vaccination advocates, however, sounded remarkably like that employed nearly a century earlier, including claims of government overreach and violation of informed consent, and familiar tropes about purity, contamination, and violation of the integrity of the human body. They highlight foreign substances in vaccines, such as animal tissue, and as we see here, aborted fetal cell line material. In this webpage, I couldn't give you the whole webpage, probably don't really need to know it, but it's very specific about these specific aborted fetuses that are used. It's a, aborted male from June 1976. I mean, it's really specific, so it's like, about the aborted fetuses used. However, much of the rhetoric now also concerns chemicals, which is a real broad blanket term for all kinds of things. Protests against the use of the preservative thimerosal, a mercury compound, was so great that it was removed from most childhood vaccines in 2001. Anti-vaccine advocates have replied that if it was harmless, there was no need to remove it. Current U.S. presidential candidate Robert F. Kennedy Jr.'s first inroad into conspiracy theories about vaccines began in 2005 with a tirade against thimerosal that was published in mainstream publications Rolling Stone and Slate. He claimed his expertise as an environmental lawyer gave him authority to speak about mercury contamination. Children's Health Defense, the nonprofit that Kennedy founded in 2007, has expanded its purview from vaccines to fluoridation of drinking water and 5G wireless technology as government conspiracies meant to kind of somehow control the population. However, the COVID pandemic has upended the discourse on vaccines and animals in more ways than one. The speed with which a vaccine was developed, less than a year, invokes suspicion among anti-vaxxers and even among people who should have known better. A historian of medicine I will not name warned in 2020 that by the example of polio, a vaccine might take a decade or more to develop. In fact, the polio vaccine probably took 30 years to develop. And this historian also cited regulatory cautions that had been swept aside in the interests of speed. In fact, the speed owed to several factors, but this included existing knowledge of vaccines that had been developed with the polio vaccine and influenza, an existing base of knowledge on coronaviruses that went back to the early 2000s and the first outbreaks of SARS, and an unprecedented, really unprecedented amount of cooperation among scientists across national and disciplinary lines, which I think has not gotten enough attention, but scientists really shared information in ways that they had never done before. As with polio, little has been said about the vast numbers of animals used to develop the COVID vaccine. Early in the process, the animal rights group People for the Ethical Treatment of Animals, or PETA, issued a statement that decried the use of animals with particular emphasis on primate use, and this, 7 things you need to know. The scope and scale of the coronavirus crisis has brought misery to millions of people, et cetera, et cetera. Even though much remains uncertain, one thing is clear: experimenting on animals squanders precious time and resources when both are in short supply. Primate use was not the primary way that the COVID vaccine was developed. The primary animal that was used was ferrets, because ferrets can get the flu. Ferrets get sick in ways that they can sneeze. They get sick in similar ways to humans. So lots of ferrets were used. Cats were used. Cats also can get the flu. Dogs don't get COVID for some reason. Once the vaccines were available, PETA took a different tack, which is kind of interesting, stating that as long as tests on animals are a legal requirement, refusing to take a medicine on ethical grounds will not help animals who have already been used in tests or spare any of the same fate in the future. It was more important to keep healthy for future activism, so take your vaccines. And in 2021, Peter Singer, of all people, urged mandatory COVID vaccination, likening the vaccine to the use of seatbelts. However, COVID and its vaccines have also provided fuel for those opposed to vaccines. We're all familiar with tropes of COVID as a foreign or Chinese disease, one that either comes from unclean animal practices, animal husbandry, or was developed in a Chinese laboratory as a weapon. These often racist conspiracy theories have gone in 2 directions. one leading to anti-immigrant rhetoric that targets immigrants as invaders and sources of disease, and the other adding to suspicion of all vaccines as unsafe and ineffective. Already in 2018, Italian researchers found strong connections between anti-vaccination and anti-immigrant rhetoric, with the contradictory conclusion that immigrants should be forcibly vaccinated to keep disease from invading with them. Underlying these ideas is a theory prominent among white supremacists of the Great Replacement, that governments conspire to replace white people with non-white people by nefarious means, including vaccination and the introduction of diseases. Robert Kennedy Jr.'s rejection of government-funded science, his call for clean food and clean soil as a solution to all health problems, and his calls for restrictions on immigration echo 19th century naturopaths and fears of immigrants as dirty and disease-ridden. A frontier ideal of self-sufficiency, and correct personal behavior that can only be accomplished by the right people is pervasive in the rhetoric of anti-vaccination. A physician who was interviewed in 2021, again, another long quote, summarized this mindset. She said, "People are told that their personal behaviors can mitigate disease risk. What I've heard from parents a lot was, we're really healthy. We eat organic food. I breastfed my children, which provided immune protection." And this physician is saying that this idea that personal behavior and hard work, or even vigilance to pay attention to who might seemingly be infected, that this could successfully prevent infectious disease is just scientifically untrue. You can't just bring up your kids and feed them well. That's not going to be enough. You have to have other ways of resisting disease. And finally, many middle-class Americans on the left have signs in their yards that declare, among other things, "I believe science is real." I've been a historian of science for a long time, and I can't say I've ever considered science as something that I kind of believe in a spiritual way. To me, it's a method, it's a way of looking at the world that has resulted in an increase of knowledge of how the world works. That has been verified in many ways, not least of which are benefits to humankind, such as vaccines. Yeah, vaccines don't always work, they're not always perfect, but they get better. Science is constantly changing, which is why it's such a powerful intellectual tool. I'm not opposed to giving opinions contrary to my own adhering, but I'm disturbed by the current insistence that all the opposing viewpoints must be heard, even if they are demonstrably false or misleading. And I'm thinking myself of current American politics. Such opinions, if unchallenged, damage the idea that there's anything that we can call true or valid, promoting instead a kind of flattening of ideas so that all are equally plausible. History may not repeat itself, but I think it can show us one way to assess current claims, which are often not new at all. Thank you very much.
Thank you so much, Anita, for this thought-provoking and super interesting talk. For many of us who are familiar with the history of medicine, there were some well-known facts in there, which we believe in. And also as historians, we have some claims to truth here in how we tell things. We have also a base in facts. And so it was very interesting to hear how you connected all these things together. And now we open up for questions from the audience. And we have a couple of microphones here that my colleagues will pass around. So do we have any questions out there? No one? Everything was so clear?
Nope.
Oh, up there.
Up there.
Top left. I should say, before the question comes up, I especially appreciated the fact that you brought up the Swedish history. That was very good, and sort of put it in a context of where we are right now. And so, please.
I don't know if you have the data on this, but I just wanted to ask, how is the... I'm sorry if I'm very nervous. When it comes to how fast a vaccine can be developed due to the corona crisis that happened, how does it look like today to create a new vaccine, depending on how big the social crisis is for it to be developed?
Well, that depends on a lot of factors, because it depends on what disease is. The thing with the coronavirus was that they figured out pretty quickly that it was a coronavirus, and kind of went from there and went back to the 2003 SARS outbreak, and then the Middle East outbreak of MERS. There's lots of acronyms here. To start to try to understand the virus. And the thing with the most successful COVID vaccines is that they were not based on any previous models. The RNA vaccines are a different technology. So there was a lot of, I think the most important thing was the information sharing, and I think it was because it was seen as such a crisis. When this all started in 2020, my husband and I were actually teaching a course on epidemics. And we started looking at, Johns Hopkins had this great map of the kind of spread of this and this was in January 2020. And by the end of the month, we're like, whoa, there's something really bad going on here. And obviously lots of other people thought this too. And therefore, it was just this mad rush to get a vaccine going. And by the end of 2020, there had been human trials, there had been animal trials, it was introduced, which is amazingly fast. And I think you have to have that sense of crisis and that sense of investment by governments, by institutions, by people to get that to happen again. So you'd really have to have the feeling that this was kind of like polio, this crisis that you had to deal with. There was no other option.
But if I may follow up on that, isn't it also the case that there had been massive government grants in the United States to work on RNA vaccines as well?
Yes.
For a while, so it was very suitable for this particular virus to work on.
I mean the technology was already developing. No, that's right. Yeah.
And so and this kind of work continues, so we are better prepared for the next crisis. But there were also so many people, as you who are scientists in the room know, who were already preparing for the next big thing.
Definitely.
Like Paula Garrett pointed out.
Yeah.
All right. Do we have more questions? Yes, over there, Mike.
Hi. This is a great lecture. I'm wondering about anti-vaccination societies. And in the beginning, you showed the Gilray cartoon. It had a little note at the bottom, anti-vaccine or anti-vaccination society. I was wondering, is that his kind of satirical invention, or were there actual anti-vaccine societies so early on? And I know maybe you could speak to also what the politics and development of anti-vaccinationism in the later in the 19th century and early 20th century, and sort of what their fate was. I mean,
I don't think there was any kind of organized anti-vaccination societies that early on. I think there was a lot of mistrust among people. And even later on, there wasn't really anti-vaccination societies in the same way that there were anti-vivisection societies that I know of. But they overlapped a lot. There were many of the same people were actually involved in both of those things, and in things like women's suffrage, and in things like anti-alcohol legislation. So it was kind of these things that you didn't necessarily think would kind of go together, but they were often the same people who were involved in all of those things. So, I mean, Shaw was in many ways an extremely progressive person. And yet he had what we consider extremely regressive views on certain things. So, yeah.
Any more questions? Yes, up there. All right.
Thank you for a most interesting lecture. Unfortunately, I was a bit late because bus sort of broke down on the way here. But as a theologian, I wonder a bit about sort of religious objections against vaccine, for example, or healthcare as such. You might have mentioned it in the beginning, but I wasn't here then. So could you please say something more, if you like?
Yes, yeah, I did mention it a bit at the beginning, the idea that vaccines somehow disrupted a bigger plan for disease as either a just punishment, or that this was somehow God's plan, or that it had a purpose we may not know that's bigger than us. And that was certainly prominent in particularly the early anti-vaccination movement, but also the early anti-inoculation movement in the 18th century, was that inoculating against smallpox was disrupting the bigger plan for the universe. But yeah, now, I mean, there are still religious arguments, certainly, against vaccination, absolutely. And again, the reasons don't seem to change all that much, that it's somehow part of a bigger plan that we get diseases and that God will somehow take care of us in that way, that death is not necessarily the worst thing. Yeah, and maybe that's simplistic, but yeah.
And I also think about the thought that it's not only God's plan, but it's also God's punishment.
Oh, absolutely. Yeah.
I think of the HIV thing here in Sweden, for example, which made quite a few otherwise perfectly normal theologians say something about, well, that's what it's like when you do bad things.
Yes, absolutely.
It's a horrible thought, but and it was amazing that otherwise fairly intellectual people could go into that.
Yeah. No, it's absolutely right. And even when people such as hemophiliacs got HIV, it was still somehow linked to this, idea of bad behavior and punishment, which was really hard to take in the early 90s.
Yeah, we have one more question up here.
Yes, I was wondering about the vivisection on dogs. Why did they do vivisection specifically instead of an autopsy to prove with the nervous system? Was it too early to do tests with the electricity to prove that the nerves were functioning? Or
Yes.
Yeah.
That's part of it. Part of it was, vivisection, strictly speaking, is like, surgical intervention. And the kinds of work that someone like Majandi was doing, which would be to stimulate a nerve and then show what part of the body this controlled, couldn't be done on a dead animal because there wasn't really an understanding of how nerves functioned. So yeah, and these were quite painful, and to spectators, I think, must have been pretty horrific experiments. I'm not going to get into whether the knowledge was worth it kind of argument, but certainly people at the time thought the knowledge was worth it. But I think you can see why critics were like, well, great, so we know that. So how is that going to help us cure diseases? And that was a pretty powerful argument for the anti-vivisection movement, was that why are we causing this gratuitous pain when it's not really helping us get healthier? As opposed to disease research where you couldn't really argue with the fact that, people aren't dying of smallpox anymore because of vaccines. So it was a really different kind of set of values that are going on there. Yeah, that's a great question.
So I was wondering if you could say something about the, we got some interesting long perspectives on these trains of thoughts that were intertwined. I was wondering if you could say something about the attitude towards animals and how it changed over time, and what was sort of what changed and what stayed the same over the course of these centuries that you have addressed.
Well, particularly dogs, their status changed a lot in the 19th century. Dogs had mostly been thought of as working animals. There were people who had pet dogs, but the whole, and my colleague Harriet Ripvo has written a lot about this, the whole kind of idea of dog breeding and having dogs as companion animals is really mostly a Victorian phenomenon. You can see there are, some portraits in the 17th century that show women with their lap dogs. But mostly dogs were dogs who, were herd dogs and things like that. So the idea of a dog as a companion, as a pet, was really something that also arose in the 19th century, just as, people are becoming more aware that, wow, they're using a lot of dogs to do this. One reason why Pasteur became so popular was that rabies was primarily seen as a dog disease, and that if you had a vaccine for rabies, that was a really good thing because we really like our dogs. And also the idea that a dog could make you really sick was that you could cure that it was safer to have a dog as your pet, I think was also important. But Pasteur was like mobbed for his rabies vaccine after 1885. He still is, I think, the best known scientist in France. I was talking about the other day, every little town in France has a Rue Pasteur. It's just, and I can't think of another scientist who has that kind of national status. And it was because of rabies. Okay. Yes, you're right. You're totally right. Linnaeus is the other one. You're right. You're absolutely right.
Hi, thank you for a great lecture. I wanted to spin on the animal research issue. You're a historian, but what do you think about the future in terms of animals in research? Will they still be used, even though technology is advancing and maybe AI will solve some of those problems, or what do you see in the future if you look at the history?
Yeah, I think that animal use might be different, but I think it's still going to be there. And part of that is that animals themselves have become so technologically sophisticated that you can breed. Well, you can do, genetically manipulate rats and mice to mimic human responses, to mimic human organs. We're doing now xenotransplantation with genetically modified pigs, which I have really mixed feelings about, because all the, excitement about this totally ignores the pig. And it's like, oh yeah, there's this pig, but that was just, the donor of the heart or whatever. And so, but that is not going to go away, I think. And I think using animals in research is not going to go away. I think it'll change, but I'm not sure there'll be any fewer animals, but I think they might be used differently. I was on an animal care and use committee at both the universities I've spent most of my adult life in, and things have changed, but there's still, that's kind of what research is in many ways, is to use animals. And I think that it would require a bigger change in how science is done than I think could happen easily. Okay.
So this tension that sort of started in the 19th century between sentimentalizing pets and then at the same time instrumentalizing animals in scientific research, this tension is here to stay?
Yeah, I mean, most animals that are used in research are mice and rats.
Yeah.
And most people aren't all that bothered about using mice and rats. Whenever you look at kind of animal rights literature, animal liberation literature, there's always a picture of a bunny and a puppy. And that's still kind of appealing to the same emotions that would have been prominent in the 19th century. Most people don't care about rats, which I'm not saying that's a good or a bad thing, but I think just most people don't care about rats. Rats have a really unique status, I have to say, among animals, because they are seen as pests, they are seen as vermin, they are seen as invasive species, and because, you know, then in the South Pacific, there are big moves to completely eradicate rats on, say, islands in New Zealand because they are invasive. And so when you think of rats in a laboratory, they're not even really thought of as animals. They're just thought of as you know, instruments. So I think it's, part of it is that change in species. I mean, most animal experiments don't use dogs. There are some dogs that are used, but it's certainly not the majority. So that's kind of different, and I think people care less about rats and mice. But I'm willing to be called wrong on that. So.
Yeah, that's a very interesting point there about the different species and how they are viewed and the symbolic aspects of that. Do we have any more questions here? Please take the chance. Step right up. No more? Well, then I'll ask another question.
Okay.
Well, I was interested in this, the racist imagery and the idea of the foreign body that's also in your the title of your talk. If you could expand a little on that, if you compare like the anti-immigrant sentiment in the late 19th century United States, for example, with the anti-immigrant sentiments that abound today, and how they connect with the ideas of infection and vaccination. In what ways do they differ, and what are the tropes that sort of connect the?
Yeah, I mean, I think there is. That's a good question, and part of this story is partly a personal story for me because my family came from Italy in the early 20th century to the United States, and there was a lot of anti-Italian racism then. And the 1924 Immigration Act, which was after most of my family was there, was directed against people like my grandparents. That we didn't want people who were Catholic, who were not. I mean, half my family is Sicilian, who were not white. And so I have a sort of personal feeling about that. And I think now it's, there is more of a feeling of kind of cultural invasion that was certainly around in the early 20th century, but in a somewhat different way. And, you know, and there's also, I mean, I'm not going to judge any country who wants to control its borders in some way, because I know that there are real concerns about employment and where people can live, how they can fit into an existing society, and I'm not going to pass judgment on people at all, but I think there are, what strikes me is that these similar language seems to be employed over and over again, this language of contamination, of somehow, you know, invading. And that's, as a historian, that's kind of what I'm trying to analyze. I'm not trying to analyze whether, you know, what's right or what's wrong, because I don't know. But it's definitely something that I see over and over again, and that repeats itself in anti-vaccination rhetoric, particularly right now. That many of the same people who are, you know, rabid anti-vaxxers are also rabid anti-immigrationists, and use very similar language.
So, allow me another question here. The invasion of the healthy body by a disease-causing organism of some sort, I can see how that can be translated into an idea of the healthy body of a country, or or like Europe as a body being invaded. But then there's also the idea of the vaccine as an invasion of the body. And that's a slightly different trope, isn't it?
Yeah, I think it is, and I think it's incredibly inconsistent.
Yeah. Yes, it doesn't really make sense.
Because that study I cited, the Italian study that showed that, you know, anti-immigration and anti-vaccination use the same, very much the same vocabulary, and then it's like, well, we should vaccinate all the immigrants. So it's kind of, okay, does that kind of go together? I don't know. But yeah, I don't think that kind of logical consistency is a strong point of some of these arguments. And when I look at, you know, Robert Kennedy Jr.'s website, not to harp on him, but it's just kind of, it doesn't really make sense. So, and I don't know how to, and that's what, you know, and I kind of got to my final point, is that there are some things that don't make sense. And either that's my failing, or else these ideas are really not making sense. They're not logical. So,
yeah, good point. Any more questions? Comments? Everything is crystal clear. Well then, all right. I'll say going, gone. All right. Thank you so much, Anita, for your talk.
Thank you. Thank you for the questions.
And we have a book here to as a
thank you.
token of our appreciation, which is on medieval fistula surgery, which is part of the Hagströmer Library series of publications. We will send it to you, so don't have to lug it all the way back. But it is an interesting book of an obscure and fascinating subject. And with that, I'd say please join us for a reception towards the entrance. There will be, some of my colleagues will show you the way if you don't find it. And you will have a chance to talk to Anita over a glass of wine. All right, thank you.
Thank you.